Hello, my name is Santiago Rios, and I'm honored to welcome you to HM860, Migrant, Refugee, and Mobile Populations Impact on Public Health. I want to try to put this course in perspective for you, and I'd like to share with you some global health facts that I think will do that. 1 billion people lack access to health care systems. In 2005, an estimated 17.5 million people died from cardiovascular diseases, representing 30% of all global deaths, with over 80% of these deaths occurring in low and middle income countries. Over 8 million children under the age of 5 die from malnutrition and mostly preventable diseases each year. In 2002, almost 11 million people died of infectious diseases alone. In 2008, there were roughly 33.4 million living with HIV, 2.7 million new infections of HIV, and 2 million deaths from AIDS. Tuberculosis, TB, kills 1.3 million people each year, with 9.4 million new cases a year. 1.6 million people still die from pneumococcal diseases every year, making it the #1 vaccine-preventable cause of death worldwide. And more than half of the victims are children, many not ever receiving medical treatment of any kind. And even half of those children who do receive treatment will die, and every second surviving child will have some sort of medical disability. Malaria causes 243 million acute illnesses and 863,000 deaths annually. But progress is being made in some areas, as reported by the World Health Organization, WHO. WHO is the directing and coordinating authority for health within the United Nations system. It is responsible for providing leadership on global health matters, shaping the health research agenda, setting norms and standards, articulating evidence-based policy options, and providing technical support to countries and monitoring and assessing health trends. The world has made significant progress in reducing the number of child deaths. In 2000, an estimated 9.6 million children less than 5 years old died worldwide. By 2010, annual child deaths had been reduced to 7.6 million. In 2010, less than 114,000 children died of measles worldwide. That is a 74% reduction from the year 2000, when more than 477,000 children died from measles. In 2010, 85% of children aged 12 to 23 months worldwide were immunized against measles. Widespread diagnosis and treatment has led to a dramatic drop in mean blood pressure in high-income countries. However, in contrast, in Africa, more than 1/3 of the population are estimated to have high blood pressure, and this condition is increasing. Worldwide, 2.8 million people die each year as a result of being overweight or obese. Between 1980 and 2008, the worldwide prevalence of obesity almost doubled. By 2008, 10% of men and 14% of women. That's 500 million people, compared with 5% of men and 8% of women in 1980. Somewhere in the world, every 2 minutes, a woman dies from pregnancy or childbirth-related causes. 1/3 of these deaths occur in 2 countries, India and Nigeria. In the past 20 years, the number of maternal deaths has been reduced by almost 50%, from more than 540,000 deaths in 1990 to less than 290,000 in 2010. But women in developing countries face 15 times the risk of dying during pregnancy or childbirth-related complications. Obviously, while progress is being made, there is much to do. The United Nations Refugee Agency reports that as of last year, 43.7 million people around the globe had been forcibly displaced from their homes by conflict or persecution. the highest number in 15 years. 80% of refugees were being sheltered in the world's poorest countries, and the agency warns that they cannot continue to shoulder the burden alone. The agency's 2010 Global Trends report said that Pakistan, Iran, and Syria were the world's largest hosts of refugees, sheltering 3 million people, among them 1.9 million in Pakistan alone. The industrialized country with the largest refugee population was Germany, hosting 594,000 people. As an Assistant Attorney General representing the Michigan Department of Community Health and the Department of Human Services, I'm involved in a lot of different types of cases involving healthcare rights, rising costs, service discrepancies and disparities, healthcare policy, but that include mental health services, home health care, Medicaid, certificate of need for hospitals and nursing facilities, the WIC program that services pregnant and lactating women and young poor children that are in risk for malnutrition and nutritional deficiencies, and a whole host of diverse stakeholders from federal, state, and local government health-related agencies and programs, and those seeking benefits from these programs, to private and publicly funded agencies providing the services to or advocating the rights of the disadvantaged and the underserved. And I can tell you that I never cease to be amazed at the good work that's being done, but I can also tell you that adequate healthcare access and delivery, especially for migrant, refugee, mobile populations, continues to be a challenge and something that needs to be addressed on many, many different planes. Political, social, economic, environmental, and geographical issues, as well as issues of legal status, cultural and language diversity, anti-immigrant laws, negative community sentiment, lack of resources, social injustice, and in some cases just plain stupidity and ignorance, further complicate and create unique challenges and opportunities in terms of healthcare access and delivery for these populations. We will be looking at all of these, and we will be exploring these all from a global perspective. Please keep in mind that the materials we will be covering are not only intended to provide you with current information and research, but hopefully it will also be thought-provoking and stimulate and generate further interest for you to explore and research the important topics being presented, always with the objective of improving the system and improving healthcare access and delivery for all people. You'll notice that there are many external links referenced in the weekly lessons. Some direct you to specific information that I want you to read and to learn about, but also there's much more information in these links that I think you'll find of interest. So please take time to poke around these websites and look and see all of the different categories of work that these agencies are doing and organizations are doing in areas that are relevant to public health and specifically to migrant, refugee, and mobile populations. You'll find a wealth of information there. I think it'll be helpful to you long term in terms of your careers, but also, more importantly for now, it'll also help you in terms of completing your weekly engagement assignments, and certainly will maybe help you in terms of developing your research project topic, and also in terms of writing your research paper as well. The materials also include a lot of good news about programs and initiatives that are in development and working to improve access and delivery for these populations. This course is intended to give you knowledge and hopefully inspire you and others working in public health to find ways to improve healthcare access and delivery for migrant, refugee, and mobile populations, including much needed research, education initiatives, as well as policy initiatives, all from a global perspective. I just wanted to mention a few things regarding the writing and final project rubrics. These are intended to help me in developing some standards for grading your work, but also they're intended to help you in terms of making your work the best product possible. So I would encourage you to become very familiar with the standards that are incorporated in these rubrics. Use these as tools to self-grade your work by double checking to make sure that you've covered all of the points and all of the relevant topics, so that when you turn in your work, it's your best work every time. The practice exercises in your semester-long research project are intended for you to demonstrate that you have a working knowledge of the material and issues that are being discussed in the materials covered in this course. But it's also to give you an opportunity to be thoughtful and creative in developing strategies and programs for positive change. You will see many common and continuing themes in the materials. One relates to the need for more targeted research. That's a key issue in this course that hopefully you'll walk away with. There's a lot of great research, there's a lot of great information, but there's much more that's needed. And another is the need for language and cultural competence in healthcare. Another relates to the need for collaborative efforts by multiple disciplines and players at all levels and from all walks of life. We're going to be talking a lot about that and the need for continuing that trend. Another common and continuing theme throughout the material is that there is a view for change to effectively improve healthcare access and delivery for migrant, refugee, and mobile populations. That it must be from a global health perspective for all people. In closing, for today's class, I want to mention that I have provided you with a working definition of public health and the essential services it provides. And you should also keep in mind that this course is intended to support the development of core public health competencies. 1, analytical assessment skills. 2, policy development and program planning skills. 3, communication skills. 4, cultural competency skills. And finally, leadership and system thinking skills. Keep all of these concepts in mind as you read the materials in the course and incorporate them into your written assignments and research project as applicable. We need to link our knowledge of the issues and problems to the public health agenda in general. Please feel free to email with any questions or concerns you might have. Communication is a key element of professionalism, so please communicate if you have a problem getting your work done, or if you have an issue with the assignments, you don't understand it, or you need clarification. I will generally answer my email within a few hours, but certainly within 24 hours. I look forward to working with all of you, and I'll be talking to you again soon.